Yeah, yeah. That's it's going to be a real, and this is just the beginning of it. This is, I think, the foot in the door, is to start creating these public works. This is far worse, I think, than the public works
Well,
that like
you
roads.
know, if we had a tax on carbon, that would be bad enough. But we're not talking about a tax on carbon. We're talking about cap and trade, which is totally different.
Yeah,
That and 2 or 3 times as disruptive as just a tax on carbon, I would think, in the sense that it is a managing of the economy by the government.
yes, and it's easily corruptible. Therefore, hard to predict how the which industries are going to get favored. You're going to watch it, a limited. They're going to create an artificial shortage of carbon emission allowances,
Credits, yeah.
and then we're going to see how they battle over it and which cronies get more credits, and the whole corrupt, as we talked about before, the tendency to corrupt that process. And then
Yes, well, the economy is going to have to shrink. That's
Yeah.
all there is to it. Our lifestyle is going to have to come down quite a bit under cap and trade, which is not just speculation anymore. That looks like the current Obama administration is headed in that direction.
It's not unlike what's going on in the financial industry. There's a lack of confidence because you don't know from one day to the next whether the government is going to de facto nationalize a bank, or are they going to otherwise disrupt it with all kinds of interfering strings attached to the bailout money. The investors are losing confidence in that industry, and it'll happen the same way with the energy industries.
Well, I'd say that investor confidence loss in the banking industry is entirely justified.
Yeah, and well, there's government interference which caused a chain reaction effect, but then their cure is worse than the disease in that they're going in and throwing money at the failures, and they're taking decision power away from these banks, and that will kill investor confidence in that industry. So, and it's probably a good segue to the healthcare Trojan horse that's in the stimulus bill too, because we're going to see a similar set of effects. Decisions being taken away from the private sector and put in effectively into the public sector. This thing, and I didn't know about it until just a few days ago when I read about this cost effectiveness analysis component of the stimulus bill. And
well, I think it's called comparative effectiveness.
Yeah, it's called.
Cost is not in it.
Yeah, that was in the title of.
It was in there originally, and they deleted it because it was a hot button issue. They took the word cost out, so now it's comparative effectiveness, not cost benefit analysis.
Oh, how convenient!
We don't say cost benefit analysis anymore. It's not politically correct.
Well, yeah, you just.
If you want to know what comparative effectiveness analysis is, it's the same as cost benefit, but it's all benefit and no cost. So they don't consider the cost, and when you give the people the comparative medicines or health care methods to compare, you don't tell them what the cost is, and so therefore they're not biased by, oh, this one costs more than that, therefore we ought to, weight it higher or lower than the other. Now, you understand how that works?
It reminds me of what kind of goes on now sometimes with the health plans, where the perverse incentive for the doctor is to throw as many tests as possible at the situation to avoid a malpractice suit, and the perverse and the more rational decision by the policyholder would be to reduce risk as much as possible by doing as many tests as possible, as long as I'm not paying.
Yeah, well, the third-party pay is really the big problem with healthcare, the way it is now and the way it's projected to be under national healthcare. When the customers and the consumers are not doing the paying, there's really covering the cost.
Mm-hmm. So, that's one argument they have on their side is the cost control is not there right now, with the third party paying and the company funded health coverage because they get the deduction and individuals do not. But this comparative and effectiveness thing it's hard to define, other than when they went down partly into this article by an advocate of this this process. There's a diagram.
Reinhardt?
Yeah, by Uwe Reinhardt, who's been a long proponent of, an economist who's long been a proponent of universal health care. He puts up a diagram, and this is reminiscent of Hillary Clinton's spider's web diagram that she had up in front of Congress in 1993. Well, this is just a little piece of it. It shows a choice on one end, and the choice branches off. You could go to course of action A or B, and then you have to assess the negative consequences of B, and then and positive, and then assess the negative and positive consequences of A. And of course, that branches out further. This is just one little node in a very large network of what. Now, when you see this, you realize immediately that this supposedly is going to help the healthcare provider make the decision. Well, help is in the Orwellian sense to me, and as I read the article, this means that the decision making is going to be taken away from the doctor, somewhat like it is in an HMO, and it's going to default to the term he used, which he tried to defend, is cookbook medicine. Now he thinks that the proponents of free market healthcare are using that as a pejorative on this element of the health plan, which is very not surprisingly got in under the radar. I just saw nothing about it in any of the coverage of the stimulus bill. But it affected.
Okay, so are you saying that you don't think that this funding should be in there, or do you think it's a good idea?
I think it's a terrible idea. It looks like it opens the door again. It's some weasel words that allow a foot in the door where the government can take decision-making power away from the healthcare providers and the patients.
Well, if the government's going to pay the bills, it has to do that. Otherwise, the costs go out of control.
Now, but
as long as the government pays the bills, if the government has to make the hard choices about who gets what kind of care. And that's just the bottom line. I mean, it has to be rationed somehow. You can't have infinite health care for everybody.
I understand.
So how are you going to ration it? It has to be rationed on the basis of cost.
I understand. Now, what I'm probably missing is this cost-effective or comparative effectiveness analysis isolated only to Medicare and Medicaid?
The way I read it, it was just anything to do with the medical profession. It was all encompassing. Any kind of care or treatment or medication would be studied under this study.
Yes, and that's what I think the foot in the door is. It's really not well defined, and I don't think stops at government funded. The 1/3 of the total health care provided, which is provided by the government, I don't think this control in this bill stops there. I think it does extend into the private side.
Sure, it's preparation for the overall plan in healthcare, which is to have a national healthcare program and have everybody covered for everything under a national healthcare plan.
Yes.
It's just I don't know what you call a foot in the door, but it's in preparation for that. Yeah.
Yeah.
It's an advanced study. You have to say, you have advanced studies for any kind of project. The long lead items, as we call them in engineering. This is a long lead item for national healthcare.
Yeah, that's what it looks like, and I guess it's not too surprising in the speed that they rammed this $800